Yeah, welcome back to DXB today, where tonight we are addressing the issue of wellness, but in a different guise, if you like. We're talking more about weight loss. It is, of course, that elixir that everyone's looking for, but is there a one-size-fits-all approach or not? To that end, we're speaking to a number of guests, and with the problems of obesity and diabetes on the rise here in the UAE, are weight loss drugs suitable for anyone wanting to lose those extra pounds at the moment? Let's find out from our next guest, family medicine consultant and an assistant medical director at our friends at American Hospital, Dr. Zahraa El Wahed. Thanks so much indeed for being with us.
Thank you very much for having me today.
Obesity and diabetes, in the years that I've been here, we've continued to talk about the issue with obesity and diabetes and the fact that it had, I mean, it's a global issue, as we well know, but here there seems to be a real problem. And yet, then we talk about miracle drugs like Ozempic, and others are available on the market for weight loss and the addressing of obesity and diabetes. How much of an impact are those drugs having on the problem?
So essentially we've seen with these medications, weight loss medications, or to put it broadly speaking, they are GLP-1 agonists. And we have seen an increase in them in the past maybe 1 to 2 years. They've certainly risen in popularity, grown on social media as well. However, to answer your question, they are an excellent adjunct to help with weight loss, but should be prescribed and observed and maintained with the input of a doctor. There's been concerns that they have been prescribed and given, maybe from the pharmacy, and not being monitored by a doctor. But this is where a good assessment and an in-depth assessment by a doctor can allow them to be prescribed and also used safely for patients. Obesity is on the increase, as you mentioned, and around 31% of people currently in the UAE are suffering with this. These medications can help with that to reduce the progression of developing to heart problems, diabetes, stroke, high cholesterol and high blood pressure as well. So they can serve as a good adjunct to help prevent that.
Zahraa, I want to ask, I was recently on a trip to America and my cab driver was telling me how he's using Ozempic, and then he was going on to tell me that the only thing he'd had to eat all day was a black coffee. And I was mortified because I was thinking, well, where are the vitamins, where are the nutrients? So how do you educate people that are using the drug for weight loss to maintain a healthy diet? Because surely that's really important. You can't just lose all the weight and, not have any valuable nutrition in your body. Is there an education system once you prescribe somebody the drug?
Of course, absolutely. And this is where the consultation is so important with a doctor. So number one, I think it's important to know how the medication works so that we can sort of explain what's the best way to eat and essentially manage your vitamins and your nutrients throughout the day. The way it works, it's a GLP-1 agonist. So it works on a certain hormone, which essentially sends a message to the brain to reduce your appetite. So it delays gastric emptying, so essentially stay full, quicker for longer. But with that comes side effects. So as you mentioned, you tend to have a little bit less to eat. You may get other symptoms, for example, feeling full quicker, bloating, nausea and vomiting, or reflux symptoms. However, that would come with education, with either a dietitian being involved or regular check-ins with a doctor as well. So the best way to counteract that would be to eat more regular but smaller meals, eating less late at night as well, and potentially less heavy meals. So things, for example, that can trigger these symptoms, like greasy meals, more sort of spicy meals as well can lead to that as well, and also quite heavy meat-based ones. But by supplementing that with protein, as Ali was saying earlier on, to try and prevent any muscle mass reduction as well, can be helpful with that as well.
Ali?
Look, it's not easy. I'll tell you as a patient, and I'll tell you as somebody who loves food, because my wife is an incredible cook and there's always goodies around. It was the most surreal experience for me because I didn't even think about food. It's all the noise was gone. The concept of food disappeared. I just wasn't interested. And I'd go the whole day, just like your cab driver, forgetting to eat and not actually being that bothered by it. But, and that's sort of the dark side of this, is that if you aren't deliberate about what you do put in your mouth, you end up malnutritioned potentially. Now that's a big word. I would more talk about it in the context of a good balance, but a good balance while on Ozempic is very different. In other words, your balance shifts much more heavily towards protein intake. It has to. Think about it this way. If you usually have not a great sort of menu on what you eat. And part of it is Doritos and part of it is junk food and so on. And if you eat the same stuff but just smaller quantities, you're not going to be getting a good intake. And so a deliberate remodeling of what you eat is super important, with a prioritization on protein. And that has to go hand in hand with exercise, but not just any exercise. I mean, it's great to walk, it's great to do cardio, great to play tennis, but the thing that's going to help you protect your muscle mass the most is actually weight training. And a lot of people don't know how to do that. So getting a coach, getting someone that can help you navigate through that is super important. You can get injured, you could sort of, it's not easy, especially for someone who's never done it. But lifting heavy things and eating a lot of protein is very, very important, and it's not easy to do. So it's super important to have someone in your back pocket, someone who can help you along that way.
Doc, do you concur?
Absolutely, and the thing is, as you mentioned earlier on, you can use the weight loss medications and you may get a few pounds off and it will do the job. But let's say if you stop it, you may go back to what you were like previously, especially if you adopt and you didn't change your previous lifestyle change. So with that, by maintaining exercise, dietary improvements, for example, and also supplementing to help with improvement of cholesterol. So improving your good fats, reducing your bad fats as well. That can also help support reduction of your sort of abnormal cholesterol as well. So absolutely, I would agree with what you're saying as well.
Amazing. Well, thank you so much, Dr. Zahraa, for joining us here in the studio and giving us your incredible insight.